In the name of God, the compassionate, the merciful. It's my pleasure to have the opportunity to be your teacher during these terms. The first of all, I started about the organization of the lower limb. As you know, the lower limb is divided into six regions: the gluteal, the thigh, the knee, the leg, the ankle, the foot. The thigh and legs have compartments with own muscles that perform group function and its own distinct nerve and blood supply. The first of all, I started to describe the osteology of the lower limbs, and after that, we will start it by the soft tissue. The first of all, I introduced the hip bone. As you know, the mature hip bone is a large and irregular bones and formed by fusion of the three primary bones, the ilium, ischium, and pubis. The ischium making the upper part of the hip bones, the pubis making the anterior-inferior part of the ilium, and the ischium making the posterior-inferior part of the hip bone. These three parts join together in one cavity. That name is the acetabulum. The acetabulum is the site of the joining of the hip bone, and here we have a hip bone. And in the floor of the hip, at the floor of the acetabulum, you can find the one Y-shaped cartilage during the embryonic period, and after the short time this cartilage is disappear and these three parts fuse to each others, and you cannot detect the border of them. And you can see that in the hip bone we have a one large foramen. That name is obturator foramen, that's made by the pubis and ischiums. The hip bone articulate with sacrum and the sacroiliac joint and form the anterolateral wall of the pelvis. They also articulate with on another anteriorly at the symphysis pubicis. At the end of the histology of the hip, you have to learn this landmark on the iliums, and this landmarks on the ischium, and this landmark on the pubis. The first of all started to describe one by one. The first of all, I describe the ilium. As you know, the ilium making the upper part of the upper part of the hip bone. For more details, I draw some pictures in here and describe how the ilium making the hip bone. The first of all, I told you that this is a ilium. We say that ilium has some borders and some surfaces. We consider the superior border or iliac crest. Another name is iliac crest. I describe by detail. Iliac crest, the anterior border, posterior border, and medial border. We say that the ilium has 4 border and 2 surface. The lateral, or we say that some text gluteal because the gluteal muscles attached to this surface, and medial surface. And the medial surface divided to 2 parts: iliac fossa and sacroiliac surface. And for more detail, I draw a simple hip bone in here, this is a antemedial surface of the bone. This is a hip bone, and here we consider the one obturator foramen here, and here we have a one surfaces that name is a auricular surface. I will describe by details. Okay, and here we have an medial borders. Okay, this is a simple picture of the iliac bones from the medial surface. I describe more. Okay, here I considered some detail about the ileum. As you see here, this part is a superior border. This part is anterior in this my pictures. In this my picture, this is anterior, and this part is a posterior. This is a superior, and this is a inferior. Okay, it is an anterior border. In the anterior border, here is a posterior border, and this one is a medial border. This part is a medial border. I draw by the color here. This is a medial border. You can see that the four border in these simple pictures, and this one is a medial surface. If you want to see the lateral surface, I have to rotate the bones. The first of all, the iliac crest. I want to talk about the iliac crest or upper part. Some texts say that the upper end. The iliac crest is a broad convex ridge forming upper end of ilium. It can be felt in the living at the lower limit of the flank. If you look at the iliac crest in above, you can see that the iliac crest is like this one. It's a S-shape structures. Is a picture like this one. In above, it's like this one. This is iliac crest. Here is an anterior in this my picture, and this here is a posterior. And you can see that the iliac crest from above, and we divided the iliac crest to two parts, the 1/3 and 1/3 posterior, approximately from here, and 2/3 anteriors. We say that ventral segment, it's more than the anterior 2/3 of the crest, and one posterior segment that making the 1/3 posterior. On the crest, in the anterior part, you can detect it three border medials. Here, if you detect it here, again, this is a medial side, and this is a lateral side. This is a posterior, and this is an anterior. You can find that the ventral segment has three border: the medial border, lateral border, and intermediate border. And to medial border, lateral border and intermediate border of the iliac crest in ventral segment, three large muscles from the abdomen attach to this border. For the lateral border, the external oblique muscles from the anterolateral wall of the abdomen attach to these parts, and transverse abdominis muscles attached to the medial border of the crest, and to intermediate part or intermediate line in this area, the medial oblique muscle of the abdomen, external oblique muscles, transverse abdominis, and here the internal oblique muscles. Okay, this is the attachment of the muscle to the crest. As the most anterior part of the crest here in the cross area, it means that in the cross area between the iliac crest and anterior border here, we have a one important landmark. That name is anterior superior iliac spine or ASIS. This is the most important landmark in here, and you can detect it in some patients. And the crossing between the posterior end of the iliac crest and posterior border, again we have another spine. That name is posterior superior iliac spine. Okay, it means that here we have a posterior superior iliac spine, and here we have a anterior superior iliac spine. Okay, another point is that if you imagine the ASIS or anterior superior iliac spine, you can find that on the iliac crest, one tubercle, that name is tubercle of iliac crest, is an elevation that lie an outer lip about 5 centimeters behind the anterior superior iliac spine. It means that you can find one elevation here. That name is iliac tubercle. Okay, that has distance about 5 centimeters from the ASIS on the lateral lip of the iliac crest. If you remember, we say that the ventral segment has 3 lip: medial, lateral, and intermediates. Okay, this is the ileum. And about the surface and another border, you can see that in the anterior border we started from the ASIS to the one area here. It means that the anterior border extends from the ASIS to the one elevation here. That name is a iliopubic eminence. This is one elevation. The junction between the pubis and the ilium is name is iliopubic eminence. Here is a anterior border. In the anterior border, you can find one notch below the ASIS, and after this notch, you can find another spine. That name is anterior inferior iliac spine. Anterior inferior iliac spine. And that's all. This is the anterior border, and the posterior border, we started from the posterior superior iliac spine. After the short elevation, you can find another elevation here, the posterior inferior iliac spine. The like uh, anterior anterior inferior iliac spine, we have a posterior inferior iliac spine, and we have a one mm, large notch. That name is a greater sciatic notch. Greater sciatic notch. This is a posterior borders. It means that in posterior border you can detect three landmarks: posterior superior inferior iliac spine, posterior inferior iliac spine, and greater sciatic notch. Alright, this one is a medial border. I described in the another slides about the medial border. Okay, this is a medial border, as you remember. Is started from the iliac crest till to the iliopubic eminence. Okay, this part of the iliac medial border, it means from here, this part, his name is arcuate line because it's like a arcuate. If you look at the pelvic bone in frontal view, you can see that it's like arcuate. Okay, the medial border divided the medial surface of the ileum into two parts. As you remember, we have a two surface in the ileum: medial, you remember, and lateral or gluteal. Okay, this is a gluteal surface, another surface, the opposite side. The medial surface divided by the medial line or medial border in two parts. The upper part is named is iliac fossa. Here is the iliac fossa. Do you remember in my division, this is the iliac fossa. And the sacropelvic part, this is a sacro, this is a pelvic. The sacropelvic part has two parts. This is the iliac tuberosity. This is the some ligaments of sacroiliac joint attached to this tuberosity. This is this is a iliac tuberosity, and this one is auricular surface because it's like a auricle of external air. This auricular surface joined by the lateral side of the sacrum and making the sacroiliac joint. Okay, we say that the medial surface has sacropelvic area. But the pelvic area, this part, this is the sacral part, and the pelvic area made the lateral wall of the true pelvis. Okay? That's all. This is a medial surface. Again, we can review the anterior border here, axis, anterior superior iliac spine, anterior inferior iliac spine. In the posterior border, this is a posterior superior spine, posterior inferior spine, and this one is a ischial greater sciatic notch. Greater sciatic notch. All of the yellow color in this picture is a medial surface of the ileums. Okay, the lateral surface of ileum you can find in here. And the lateral surface, another name for the lateral surface, as you know, we say that the gluteal surface, because there's some gluteal muscles attached to this surface. This surface divided to four area by three lines: posterior gluteal line, anterior gluteal lines, and inferior gluteal lines. Okay, posterior gluteal line, anterior gluteal line, and inferior gluteal line. By these lines, the lateral surface divided to four areas. You can see here. The posterior gluteal line started from the iliac crest around 5 centimeters from the posterior superior iliac spine. This line started from the iliac crest and go down and back to upper part of the greater sciatic notch. The anterior superior spine started from the iliac crest about the 4 centimeter from the axis. This is the axis, and go back and down and terminate in the apex of the greater sciatic notch. And the inferior gluteal line, this is another line that started above and back of the anterior inferior iliac spine and go backward and end in the near the apex of the greater sciatic notch. Between these lines, the posterior gluteal line is shortest lines. By these lines, by these lines, the lateral surface divided to four area, and this in each area some muscles is attached. For example, here the gluteus maximus muscles attaching here in the between the posterior and anterior gluteal lines. The gluteus medius muscles, attached for the this area between the anterior and inferior. The gluteus minimus, another gluteal muscles attached in here, and below the inferior gluteal line, this area, the one of the head of the rectus femoris muscles attached to the this area. Okay, a lower part of the ileum in here, you can see that take part in the formation of the acetabulum for the hip joints. Okay, that's all about the ileum. The next step I want to talk about the ischium. The ischium divided to two parts. Okay, the body and the ramus. The ramus of ischium joined to inferior ramus of the pubis to form a bulb of bone, ischiopubic ramus. You can see that here. I come back to these pictures. You can see here, this is a body that joined to the ileum, and this part is a ramus of the ischium. You can see here, and joined to the inferior ramus of pubis, and when they fuse together, we say that the ischiopubic ramus. Okay, in the body here and the ramus. For the ischium, we say that the ischium has a body and ramus. Okay. The body has some borders and some surface. The border is anterior, posterior, or laterals, and the surface, the surface of the ileum, ischium, excuse me, the surface of ischium, we say that the posterior surface or dorsal at femorals and pelvic. Okay, and about the ramus, The ramus has a two border and two surface. Is not important. Superior and inferior border and medial and lateral surface. Okay. About the scium, if you look at the scium in these pictures, excuse me, these pictures, here, this is a posterior border of the body that continue or with posterior border of ileum. This is a posterior border of ileum. Excuse me, I want to change the colors. Okay, this is a posterior border of the ischium. Okay, this one is a lateral border, and this one is the anterior border. Okay, now you can find the three surface here. This is a posterior surface. This is a femoral surface. In the opposite side, you can find the pelvic surface. Okay, and the posterior border of the ischium, you can find the remaining part of the ischial greater sciatic notch here. We say that the greater sciatic notch made by the posterior border of ileum and posterior border of ischium, ischial spine, this one, greater, lesser sciatic notch, this one, this is another notch. We have two notches, lesser and greater sciatic notch. And ischial tuberosity is important landmark in here, ischial tuberosity. Okay, I want to talk about the ischial tuberosity because the attachment of the ischial tuberosity is important. If you imagine the ischium from the posterior view, you can find that the pictures of this part like this one. For example, this is a greater sciatic notch and ischial tuberosity from the posterior view. Okay, this is a ischial tuberosity. If you imagine the ischial tuberosity divided by transverse line in two parts, upper and lower parts. The upper part again by oblique line divided two parts. That's one. We have to draw a direction of my pictures. The superior, inferior, and this is the laterals, and this part is the medial. Okay. By transverse line, we divided the ischial tuberosity to two parts, upper part and lower part. The upper part by oblique line again divided to supralateral and infralaterals. And the lower part again by vertical line divided two parts, medial and laterals. Okay, finally you can find four area on the ischial tuberosity. And the lower medial part, this part is a subcutaneous part. It means that doesn't anything attached to these parts. Subcutaneous area. And another part, the three parts remain. The some muscles of the back, on the posterior part of the thigh is attached or originated from the here. The supralateral part, the semi-membranous muscles, Semimembranous is one of the muscles is the back of the thigh attached to the superlateral part of the ischium, and supramedial part, two muscles of the back muscles again attached to this area. This one, semitendinosus. And long head of biceps. Okay, long head of biceps, semitendinosus, and long head of the biceps. Now two muscles attached to this area. And one part is remain, lower lateral part here. The one of the head of the adductor magnus is one of the muscles in the medial side of the thigh. His name is adductor magnus. The adductor magnus, one of the important muscles on adductor muscles, ischial part or ischial head. Okay, ischial head of the adductor magnus attached here. The ischial tuberosity is important because all of the muscles in the back of the thigh originated from this tuberosity. Okay, you can imagine my picture in here. I divided the ischial tuberosity to 4 parts. Okay, do you remember? Like my pictures. And this is a oblique line, and you can see that this tuberosity divided into 4 parts. Okay, another important part is the pubis. Pubis is divided to flat medially placed body, superior and inferior rami that project lateral from the body. Okay, and the body, the pubis, pubis has a body and 2 rami, superior and inferior. Okay, the body is a short part and has some surfaces and some border. It is not important, but I talk about some important point of the pubis. Okay, the first of all, about the body. The body is a flattened form before backward and has a superior border called the pubic crest and 3 surfaces, anterior, posterior, and medial. Anterior, posterior, or medial. The medial surface is important because joined with another medial surface, because we have a 2 pubis, by a 1 cartilage. That name is symphysis of pubis. Is a one important joint is formed here. For example, is this one. This is a 1 pubis from here, from the one side. This is a medial surface. This is another surface. Okay, this is the anterior surface of the pubis, and these 2 parts to join together by the 1 cartilage is forming here. The 1 cartilage is, we have 1 cartilage here. That name is symphysis. This is a symphysis pubis or pubis symphysis. Okay, this is a medial surface of 2 body of the pubis making symphysis of pubis. And this is a body, and as you see this picture, we have a 1 superior rami and inferior rami. Excuse me, something is wrong in here. Okay, this is a superior rami, and this one is inferior rami. As you know, the inferior rami joined the ramus of the ischium and making a ischial pubic ramus. And this is a superior. And the body has a one, I told you that has a one superior border of the body, some border. Superior border is important because we say that then another name for the superior border here, this is the superior border of the body, his name is pubic crest. Pubic crest. Okay, the pubic tubercle is lateral end of the pubic crest. If you go to the laterals, here we have a one tubercle. That name is here. This is a pubic tubercles. It's a lateral end of the pubic crest. Here, this is a superior ramus. As you see here, the superior ramus has many borders. Okay, the superior ramus uh, has a many border. It has a three border and three surfaces. The superior border is called pectinal line or pecten pubis. Is a sharp crest extending from the pubic tubercle to posterior part of iliopubic eminence. The anterior border is called obturator crest. Here his name is obturator crest. Obturator crest. And this one is a pectinal line. Between these two border, we have a one triangular surface here. That name is pectinate surface. The pectinate muscles attached to this area. Okay, I think that's all and enough for the pubic. And in this picture, you can find that there's some ligaments. We have some ligaments in here. The sacrotuberous ligament, this vertical ligaments here. This is a sacrotuberous ligaments. Okay, and the one small transverse ligament, that name is the sacrospinous ligament. When these ligaments attach to the posterior part of the ileum, you can find that two foramen is formed. The one of them is greater sciatic foramen. Another one is a lesser sciatic foramens. Lesser and greater. Some structure passing through this foramina. And another thing is the obturator foramen. For obturator foramen is obliterated by the obturator membrane, and only the one small part is open, is open. That name is obturator canals. The obturator artery and nerves pass through these canals. And finally, I want to talk about the acetabulum, and you find it. The acetabulum is a deep cavity that the head of femur joined with the hip bone and making the hip joint. The acetabulum divided through two parts. The non-articular part, his name is acetabular fossa, and the one articular part, acetabulum. In here you can find the lunate hyaline cartilage, the head of the femur joined by this cartilage. This cartilage exists in the anterior, superior, and posterior part, but in the inferior part, we have a one notch or one defect. That name is acetabular notch. Okay, the acetabulum made by three parts of the hip bone. The upper part by the ileum, this is ileum, the inferior anterior by pubis, and posterior inferior by scium. Okay, that's all. It's about the hip bone. You can see here that two hip bone when they join to the sacrum. This is a sacroiliac joint in here. This is the symphysis of pubicis, as I told you. The female and the male and female pelvis, you compare them together. Another, the lateral view and inferior view of the pelvic bones. Okay, that's all. This is about the hip bone, and in this is finish my lecture in this part, and in the next part I will talk about the hip bone.